The study is a meta-analysis of approximately 90,000 patients who took statins for a period up to 4 years. And what it shows is that there is a small increase associated with statin use over this period of time. There was about a 9% increase in the risk of developing diabetes in patients who took statins. It didn't seem to be related to a particular statin, and it appears to be a class effect.
An analysis of many studies found that cholesterol-lowering drugs known as statins increased the risk of dying by 1% over 10 years. One study found 15 times more breast cancer in women given a statin. This is according to an excellent letter to the editor published in the Wall Street Journal on May 25, 2003, about statins by Professor Joel Kaufman, who's Professor of Chemistry Emeritus, meaning that he's retired, from the University of Sciences in Philadelphia. And here's a screenshot from their website so that you can see what he looks like. So let me go through this letter. The first thing he notes is that the association between statins and lowered levels of coenzyme Q10 leading to congestive heart failure has been known for 15 years. So again, this letter was published in 2003, so in other words, it has been known since the late 1980s that statins lower levels of coenzyme Q10, which increases the risk of congestive heart failure. The next point he makes is he talks about a study, two studies actually, one called the Excel study, another one called the AFCAP study, which involved the statin known as Mevacor, found an increased risk of dying in those given the drug. So in other words, two studies found that Mevacor increased the risk of dying. He goes on to note that in a trial known as the CARE trial, breast cancer rates increased by 1,500%. In other words, breast cancer was 15 times more common in women given the drug Pravachol. It's also worth noting that in an article, the cover story in Business Week on January 17, 2008, stated that statins have never been found to benefit women of any age. It seems to me that statins should never be given to women. They have never been shown to be effective, and they may have this safety risk. He goes on to note, talk about another trial called the Prosper trial, which involved Pravachol. They found the total risk of death was unchanged. There were fewer cardiovascular deaths, but there were more deaths from cancer and stroke. So in other words, Pravachol reduced the risk of dying from a heart attack, but increased the risk of dying from cancer and stroke, so that the overall death rate was the same. I have to ask, how many doctors and patients would use these drugs if they knew this? He goes on to talk about another trial called the All-Hat trial, and also involving Pravachol, and found it did not reduce either all-cause mortality or heart disease after 5 years.